We are back with Dr. Ted Manny, a urologist with Cone Health, talking about prostate cancer. In the last segment, he talked about a free Cone Health clinic that is on Tuesday, September the 23rd from 9 to 1. We want to make sure that you have the phone number to register for that free clinic. We're going to be putting it at the bottom there. We'll leave it up for a little bit so that you'll have that. All right, in the meantime, let's talk about this. Does an elevated PSA level always mean that there is cancer?
Fortunately not. The PSA blood test, which is a part of prostate screening, is good, but it's not perfect. There are lots of false alarms. Other things can make it go up. A recent infection, or even just a really large non-cancerous prostate can make it elevate. So that one elevated PSA, concern, but not alarm.
Okay, and so that means if your loved one goes and gets that elevated thing, you don't have to automatically jump to the conclusion that something is wrong, but it is something that you should be taking a look at. All right, what kind of steps can men take to lower their risk of prostate cancer?
So prostate cancer, unlike lung cancer, for instance, is not as responsive to lifestyle changes as other ones. But that being said, smoking does influence it some, so smoking cessation can lower our risk. And also, we want to make sure that we're having alcohol in moderation. Less than 2 drinks a day. Alcohol in very high concentrations can also increase our risk of prostate cancer some as well.
Okay. All right. And then let's talk about some common misconceptions, because I'm sure that there are plenty of them out there. Maybe your top 3 out of the top 100 that you know. What are some common misconceptions about that you want to address?
Sure. I think the biggest one now is that one misconception is that prostate cancer only happens to much older men. That's just not true. We're seeing a trend in all sorts of cancers towards more aggressive disease at a younger age. And we're seeing men in their 40s unfortunately show up with pretty aggressive disease. So prostate cancer, it's a disease of middle age and older men too, not just older men. That's the first biggest misconception. The other is that if a man's diagnosed with prostate cancer, it always means that some sort of terrible treatment is necessary. That's not true. Treatments have become much more streamlined with time, and a lot of men actually monitoring is a great way to manage things. So that's another big misconception, is that a diagnosis automatically means that things are going to be unpleasant. That's just not true.
All right. Well, you did mention that treatments have changed compared to years past. So what kinds of treatments are we talking about?
Sure. So one of the biggest changes in our field in the last 20 to 30 years has been a concept called active surveillance. And this is for the man who has the smaller, less aggressive cancer. We've gotten better as a field at identifying ones that really shouldn't be treated and just monitored alone, such that now about 50% of men who are diagnosed with prostate cancer actually just have monitoring. And for those who have more aggressive disease that do need treatment, surgery and radiation are both great options, and the technologies are always improving, with side effects becoming less and the invasiveness becoming less every year.
Yeah, we all like to hear that. I'm going to ask about your final thoughts, but I do want to ask this because I want you to talk to all the men out there who don't like to go to the doctor.
Well, I don't blame you. I can be one of them too at times. But the biggest message is screening saves lives. Since the introduction of the PSA blood test, the cases of metastatic prostate cancer have actually decreased 70%. So, for the ladies out there, encourage that man in your life to get screened. And for the men out there, it's okay to do. It saves lives, maybe even your own.
Okay, and when we talk about this free screening event that's in a couple of weeks on that September 23rd, what happens during that screening time? Like what will men be asked to do, and how long will it take, and that kind of thing?
It'll be very quick. It'll be a simple blood test that's looking again for that PSA level, which is an important part of screening, and then some history and just a quick exam. I imagine it would take less than 5 minutes. It'll be quick.
Okay. All right. So we want you to be able to register for that. We've got the number that's on the screen right now at the bottom, 336-832-0849. It is free to go to this screening event, but you do need to register so that they make sure that they have all of the resources and things that you need. Thank you. We so appreciate your time and expertise. If you want to see this interview again, maybe you need to send it to a loved one who needs to hear about this. It'll be in the To Your Wellbeing section of our website.